Look this half hour at our nation's Capitol building. The Trump administration in Washington, D.C. is planning on big cuts to the Department of Veterans Affairs with a goal of returning to 2019 staffing levels. But some people are concerned, a lot of people are concerned, what the layoffs and other changes could mean for access to veterans' mental health care. Erie News Now Washington, D.C. correspondent Brendan Scanlon talked to those close to the issue and joins us live tonight with more details. Brendan, good evening.
Hey there, Eva. Good evening to you. This is sort of a two-pronged issue. First, the Trump administration ordered folks to return to the office. So mental health workers that are part of the VA who typically work remotely have to now return in person, which some are worried could compromise the quality of that mental health care. The second issue, of course, are those mass layoffs, Eva, that you mentioned. Some believe that that could impact professionals' ability to answer the phone when a veteran is in crisis.
Every day, 19 veterans are taking their own lives. So the programs are absolutely critical.
Former Navy SEAL Tom LaGrave says he and other veterans have not felt the impacts of federal downsizing, but concerns are growing.
We're hearing the downsizing, and that creates anxiety with I and the rest of the veterans that I've been speaking with, because we don't know what that means as to whose job is at stake, because all of them are wraparound to serve us because we served our country.
By the end of the year, the Trump administration plans to lay off as many as 80,000 VA employees.
The past few months, thousands of VA employees have been fired and many more are on the chopping block. Suicide and crisis hotline staff have been scrambling to answer calls amid a hiring freeze.
Senator Kirsten Gillibrand warning today that the impacts could be catastrophic on veteran care.
By gutting the Department of the Veterans Affairs, the Trump administration is leaving these brave heroes in the dust.
Mental health professionals who reach patients remotely are being called to return to the office. Some worry the change will compromise patients' privacy and quality of care.
Sensitive telehealth appointments from crowded offices, compromising patient privacy and potentially violating professional mental health care standards.
We want to work directly with our veterans, providing the best care we can provide for them because they've earned it.
Congressman Mike Kelly says supporting veterans is a bipartisan issue. He says he's unaware of any tangible, harmful impacts from federal downsizing.
I want to talk to somebody if they've lost something. I want to know about it because, to my knowledge, that has not happened.
And Eva, as you mentioned before, the administration's objective is to cut enough employees to return to 2019 staffing levels at the VA of about 400,000. But that means cutting tens of thousands of positions that were added when the VA was expanded during the Biden administration. Of course, if you or a veteran you know is struggling with mental health, that veteran crisis hotline is 988. Reporting live on Capitol Hill for Erie News Now, I'm Brendan Scanlon. Eva, back to you.
So very important to know, Brendan.